We're in conversation with Mr. Jawaid Akhtar, the additional Chief Secretary in charge of health for Karnataka. So thank you very much for talking to ET now. Even as we speak, the last update we got is that the Karnataka COVID tally has nearly climbed to 4 lakh. It's at 3.98 lakh now, and the numbers in Bangalore continue to climb. Where do you really see this heading, and do you see the numbers stabilizing anytime soon? Because it's been this trend for the last few weeks. Can you give us some ideas?
Uh, in Karnataka, what we have done, we have increased the number of tests drastically uh, in pursuance to the Government of India's instructions that we should scale up the test. It helps in identifying all those who are positive and bringing them to either isolation or treatment. So earlier we were testing some 10 to 15,000 persons every day. That has been scaled up to 75,000 now. So obviously, in a particular level of infection in a population, if you increase the number of tests, you will certainly have higher number of positive persons. But our effort is to bring down positivity to below 5%. So about in July, when the spike happened after the unlock, then the positivity crossed almost 20% in Karnataka, and we have been consistently trying to bring down the positivity. So it has now come down to 14%, and it is still going down. We are comparing week to week, fortnight to fortnight. The positivity is coming down continuously and consistently. So our aim is that we should do tests in big numbers. We should test all those who are having symptoms. We will test all those who are in containment zones in order to isolate them early to bring down the fatality. Even though the number of cases might be high, but we will be able to cure the people and bring down the fatality rate.
Right. Mr. Akhtar, the other point I wanted to check with you was yesterday the first case of reinfection has been reported from Bangalore, which people are saying is the first in India, where a 26-year-old lady contracted COVID a month after she recovered from it. Is this an alarming trend? Are you seeing more instances of this? Because so far the government has said that the probability of reinfections are low. So how do you see this, sir?
See, doctors are studying this case, but the fact remains that it depends on the life of the antibody which cures a patient. If the antibody which forms in the body it lasts for long, then obviously there will be no reinfection. This might be one-off case in which the antibodies might not have lasted for long. It is under study. We don't have all the details right now. We don't have the details of the first test as well as the second test. I have requested our doctors to collect all the details and study it, and also to notify to Government of India, ICMR.
Right. Right. Also, sir, I wanted to understand, since the cases seem to be going up, positivity cases seem to be going up, the recoveries also at the same time are going up. So that's a positive trend. But will this
Yes.
make Karnataka relook at the rate at which it has opened up? Because Karnataka is one of the most open states in India today when, I look at other states and lockdowns. So will you kind of relook at some of that, or will you continue with how you have been in terms of opening up the economy and industries?
As you have rightly said, Karnataka started opening up gradually quite some time ago. And this is one of the most unlocked states. And what you are seeing is the peak at this stage, and that too when we are testing large number of persons in the state. So the spikes that are being witnessed might be the worst, because two things are happening simultaneously. As I have said earlier, the positivity is coming down. So it has come down from 21% plus to 13% now. But the larger effort is to bring down the fatality. At its worst, the fatality was also 2.1%. It crossed the then India's fatality rate by a fraction. But now we have been able to bring down. So our overall fatality rate stands at 1.6% compared to 1.7% for the country. But you see for the last 15 days, it was 1.4. and for the last 7 days it was 1.3. So our objective is to bring down fatality to less than 1%, the goal set by WHO as well as the ICMR. We are moving towards that. So what I'm submitting, because your question was in connection with the unlock. So we have very systematically opened up the state because economic activities could not have been curtailed for long, and now at its most open stage, we are able to bring down the positivity as well as fatality. So I think the worst might be over soon. Thank you.
Right. So one indicator that various states and the government is also using is the serological surveys. Any data in Karnataka or Bangalore, to give us a sense of whether what percentage of population has immunity, what percentage of population has been infected? Any details on that?
The data that I have of serological test is quite old. It is irrelevant. Another serological test has been done recently. I think in a week's time the data will be out. This is the network serological test conducted by ICMR across the country. So from Karnataka, 3 districts were included. So that serological test is over. We are waiting for the data. There is another serological test that the state has taken up. It will take some more time. So right now, I don't have a specific data of this serological test to indicate about the spread of this disease in the society.
Right. Final couple of questions, sir. Will Karnataka be part of the next round of vaccine trials? I think the first round, the institutes here were not covered. Are you talking to ICMR on this?
Yes, we are included in the next round of trials. ICMR has included Bangalore.
Okay. And finally, sir, any update that you have in terms of the industry or factories? How active are they? I visited a few malls last week. They said, people are still not coming, though tier two towns are more active. It's the same when it comes to the nightlife in the city. So are you seeing things come back to normal?
Yes, broadly, I will say that things are coming to normal, but the details, whether the nightlife is now become normal and all the factories are working at their peak, I will not be able to give the exact uh, replies on this. You may have to check with the Department of Industries. And as far as the if traffic as an indicator, but we see that the traffic is getting resumed in Bangalore very substantially. So right now, I think the traffic might have come down to say about 80% of the 80% of the original that used to exist before the lockdown started in the month of February.
Okay. And final question, sir. In terms of the hospital health infrastructure, ICU, oxygen supply, where is Karnataka? Are we prepared for, say, a second wave or a spike going forward?
Yes, from the beginning, we have been preparing ourselves. So, I mean, when we talk of ICU, it primarily means that high dependency unit where oxygen is available and some sort of HFNC type equipment is available. We are expanding that. So, we have very good number of uh, these HFNCs as well as ventilators, which can operate on NIV mode. And apart from that, we are also expanding. But one important project that we have taken is will be quite significant. We are providing uh, minimum 125 beds, connecting minimum 125 beds with oxygen in district level hospitals, 50 beds with oxygen at taluka level hospitals, and we will be oxygenating all the beds of the CHCs. So this will bring down the number of oxygenated beds in the health department, government hospitals itself to more than 18,000. So this is apart from the major hospitals. We are working under the medical education department and also the private hospitals, which also have substantial numbers. So we are upscaling the facilities in the hospitals. We are increasing the number of oxygenated beds. We are also providing HFNCs and ventilators for the better management of moderate and serious patients.
Great. On that note, thank you very much for talking to us, sir.
Thank you.
Take care.
Thank you.